Lower backs. Okay,
There we go.
here we go. These are the hips and lower back sessions. Oh my goodness, we're talking the powerhouses of your body now. Holy cow. These are the ones that are going to power you through your races, and a lot of people have problems with that. Believe me, I do too. I can't do a lot of things. I used to be doing a lot more, but let's get started. Enough about me. I'm a registered massage therapist, have been since 1981. That makes it 43 years and going. And I've learned a few things from being a runner in my life. Okay, so first of all, what we're going to do is we're going to talk about alignment of the body. This is crucial because if your body is suffering either in the lower back or the SI joints, then it's going to be a little bit of a problem. Okay, so normally, I'm just going to use this piece of paper as a prop. So normal movement through the back, through the hips is back and forth here like that. Okay, normal movement. Okay, when stuff happens, and you might find that if you have lower back pain or in the SI joints, that one side is a little bit tighter, and so you got a little bit more compensation going on the opposite side here, and a little bit more rotation than it should be in the center at your spine. So what are we going to do about this locked piece here? Okay, now what I'd like you to do is, if you can stand and do this with me. It's called a donkey kick. Really, really easy. So all what you're going to do is you're going to straighten your leg out behind you here like that and give it a solid kick. Not a whip kick like that, but a solid straight down kick. Don't hit your toes on the floor. 3 times like that. And that will help in mobilizing that stuck joint. And now you'll have normal movement back and forth again like that. Okay. So if you have lower back pain, or specifically in the SI joint area here, you'll be able to point to it directly and say, I've got pain right there. What do I do about that? Well, it's the kick. Okay. No one's going to show you that. Only Tilman will show you that. But try that, and you'll be able to manage your own back pain without having to go and run to a therapist. Okay. So whenever you have SI joint pain, try that. If you get confused as to which side, because sometimes it'll move around a little bit because of compensation, try both sides. Only 3 times, that's all you need to do. And what that will do is it'll correct the movement of the hips in the back, and it will give your muscles a chance to adjust to that new form. Okay, very, very easy, very simple. Okay, the other problem there in the alignment in the back is with your lower back, specifically the facet joints. So you have here the vertebrae, they're stacked up on each other like this, gong, 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 gong. And you have here in between these vertebrae, you have the facet joints that come down on the sides of the vertebrae. So how are you going to stretch those? Well, there's a great stretch for this, and it's for your quadratus lumborum, which is this small muscle in through the back. I'm going to show you how to do that right now. Okay, very, very active session here today. So if you're going to feel tired after this, this is a good thing. So I'm going to get here on the side of the table here like this. Okay, and I have a little platform where I can put my arms down. If this is too much of a bend for your back, try a countertop a little bit higher, but for the sake of this video, it's going to be here. So what's going to happen is you're going to turn your feet to the side, okay, pointing out like that. Okay, so it's perpendicular to the table. Okay, and then what you're going to do is you're going to take the knee that's closest to the table and bend in on it, keeping the outer leg straight. Okay, and now when you're doing this, I want you to extend your arm this way. So it's straight leg, straight arm. Okay, and then you're going to get a stretch down through the QL area, the quadratus lumborum. Okay, and that's going to, you're going to feel probably a stretch through the bum, through the glutes, and through the hamstrings. But this is a great stretch to do anywhere. Okay, this is part of my routine when I've got an achy back. Okay, and so all I do is straight arm, straight leg, hold it for 5 breaths. How many? 5. And then you can turn around and try the other side as well, like that. Okay. Now, this stretch is also great for women who are pregnant because your back is always going to be sore, right? So anyways, this is a great stretch to stretch out the sides of your back without getting down on the floor and rolling around on there. Okay. So if anybody in your community is pregnant and has lower back pain, show them this stretch. Oh my God. And get them to show other people too. It should be shown a lot. Okay. Saves a lot. Okay. So anyways, that's that, the facet joint. But there's one more really great one that I use when I prepare for races. So I'm there in the starting corral and I want to get myself loosened up. Okay, what can I do for my lower back if I feel some tightness? Well, it's very easy. You're going to get up here like this, put your hands on your knees, and then you're going to move your knees back and forth like that. Okay, it's called a bum wiggle. So I'm just going to move like this. So you can see my bum going back and forth like that. The facet joints on either side, if you get some clicks out of that, that's going to be really good. It's also called an elephant walk, believe it or not. And it's great for, say, sciatic pain. Unbelievable, like that. Okay, I just modify it to put my hands on my knees so I can push on the shoulder, move the shoulder up, creates a nice long stretch through the back too. Elephant walk like this, maybe down for lower part. But this one, oh my goodness, so much more, so much better. Woo-wee. So that's with the lower back. There's one more that's really good, and that is a side stretch. Now you can cross your arms and turn like that. And in my therapy sessions, I always finish the treatments like this because it just creates a little bit more flexibility in through the back and doing that. And so when people leave, they're like, holy cow, so flexible, unbelievable. Yeah, a couple of stretches, whatever, right? So what you're going to do is cross your arms and you're going to turn. You can do that, or you can extend the arm out like that. But what I'd like you to do is have your head follow with that. A lot of people don't. And if they don't, then it's going to be more of a thoracic stretch. But if you're following with your head, the effort is on the lower back. Now, the lower back doesn't rotate all that much. It's less than 5 degrees, but that's just the ratio. What is happening here is you're stretching those muscles up, right? And so from time to time, that's a great stretch that you can do. There's other stretches, but those are the ones that I find are the best. Okay, they've helped me a lot. And so let's move on into stretching, not the joints specifically, but the muscles. Okay. And oh, there's so many great ones. Holy cow. There's one that's called table stretch that I've already done here with the box on the bench. Show you again. Okay. Table stretch. Here we go. Like this, long arm, long leg, bend in on the knee, right? Oh, that's the table stretch. Awesome. Great table stretch. Okay, the next one, I call them lazy bed stretches, and they're specifically for the IT band. I showed you one last week with the iliotibial band. So lazy bed stretch, what you're going to do is you're going to hang off the leg off the end of the bed. Reason for that is all the other muscles in your body are in a neutral position and you can focus directly on the hips. So I'm just going to get on this bed here and then bring the leg off the end, off the side, and you'll feel the stretch through the iliotibial band. Okay. Now, with the iliotibial band, this one here, more in the front and on the side, a couple of things going on there. You can also have a trochanteric bursitis, which might be a real issue for some people, and that's usually from overdoing it. There's really not a lot of things that you can do about that. Pain relievers, crutches, stretches, and strengthening exercises for that area. And then, of course, also steroids and shockwave and all the rest of it. And then eventually, maybe even a procedure to relieve some pressure around that. But let's not get into that. That's a whole nother ball of wax. Okay, so trochanteric bursitis, You can cool it down, put a cool pack on there if that acts up, but usually what it is overuse of doing some sort of exercise, and you just have to put a pause on everything, have it settle down, and then start slowly back up again to get yourself going again. Okay, so those are that with trochanteric bursitis and IT bands. Okay, now there's another one here, the hip flexors, which is an awesome muscle because this muscle actually helps in bringing the leg forward here like that. Or hip flexors, all of them, you know, but wow, if you can't do, you know, how maybe in your younger years you sat there in school and you had to do the high knees up like that. If you have a problem with that, then your hip flexors are weak. And if your hip flexors are weak, then the gluteal muscles are going to be tighter. And then that's a problem too. That's where you're going to get a little bit of pain in the bum, maybe tightness in the hamstring muscle. And I'll just cover those in a minute. Okay, but right now, this hip flexor stretch is just awesome. It's works more so for the quads, but it's a great one. So what you're going to do is you're going to lie on your bed, and you're going to bend one knee up and the other one down like that. Okay, one leg straight, one leg straight, one knee bent, and all what you're going to do is lie on here on your belly. It's one arm behind you, and you're going to hold on. You're going to rest like this for at least 10 to 15 minutes. And what's happening here is you're going to get a stretch on the long side, the leg that's on the bottom, that's long, and it's going to be in here through the psoas muscle. That's where you're going to feel that stretch. And that muscle is a small muscle. It does not like to get yanked all that hard. So for a great stretch, this is what I'd like you to try. Get on your belly. And if somebody says, oh, he's just always lying around. No, you're not lying around. You're stretching, right? You're not being a lie about. No, stretching. So put your arm long behind you there. You're just resting like that. Very, very cool stretch. And then after 10 minutes, try the other side. Swing your arm around. Okay. Long leg, arm behind you. And you rest for another 10, 15 minutes. Okay. If you have a problem getting up out of bed and you're like an old man and getting up like this, try this stretch. It's going to make a world of difference for you. Just very simple stuff like that. Simple yet powerful. Okay. So there's another one that's awesome to do as well. It's more of a quad stretch. And I'll tell you why, because it also helps with well, if the quads are really tight, then they're not going to be able to extend very well, right? So, you know, you can try a quad stretch like this, but you're going to have a bend in the back and in the hip, and it's not going to be all that straight, right? So let's get you down on the table here or on your bed, and you're going to hang on to your ankle like that. And again, 10 minutes. If 10 minutes is okay, that's great. I feel a quad stretch coming on. Woo-wee. Okay, great quad stretch. And of course, you can try the other side. That works too. But I find, again, because your body is in neutral position, the focus of the stretch is actually on the muscle that's really needing to be stretched. Okay, very, very simple. Okay, now I'm going to move over to another awesome stretch that is for lower back pain. If you've ever found somebody that has a back spasm, and say, hey man, don't suffer. Get yourself 2 pillows. This, by the way, is called a 2-pillow stretch. What you're going to do is sit on the pillows, and then you're just going to roll over onto the pillow like that and hang out. So, oh, wow, that's a really great stretch down through there. Holy cow. Yeah. So hang out like that. 2-pillow stretch. It's a physiotherapy stretch. It's awesome. So anybody who's got a lower back spasm, no need to suffer. Show them this. Okay? It's perfect. The 2-pillow stretch. All right. Carrying on. Now, There are other ones that are for the pelvic floor. And oh, there's so many good ones. All right, so pelvic floor stretch. It was way back. I was preparing for a marathon, and my hips, they were so stiff, and I thought, God, there's got to be something I can do about this. So, great stretch here is a starter pose, I call it. So you're in a stance like this. You put your hands down on the inside like that, and you're just hanging out like that. Okay, and you'll feel a good stretch through the pelvic floor. Okay, that's a great stretch to help with the hips. It's more for the internal rotators of the hips, but holy cow, man, it's just an amazing stretch. I call it the starter pose. That's a really good one. For hamstrings, oh my goodness. A seated hamstring stretch. You put yourself up against the wall, just like that, and legs straight out. You'll be surprised as to how many people can't even do that. They're like, it hurts so much. Put them straight down like that. If you need to take some of the pressure off, spread your legs apart a little bit, and then you can wibble the feet back and forth here like windshield wipers. Okay, what does that do? It helps move the muscles here at the back of the hips. Okay, windshield wipers with your feet. Try that next time. If it's super sore, if it's super tight, then you know, hey man, why don't I do that for a little while? Get on a meeting or something like that, sit on the floor against the wall. Yeah, I'm having a great time. Do two things at once, stretch and talk. Hey, how about that? All right, so now there's another one that's awesome. It's called a dynamic frog stretch. And I gotta tell you, I was in Ohio a few years ago, and I came across this frog jumping contest in a place called Valley City, Ohio. Unbelievable. I just had to enter it. Why not? So I got a couple of frogs and made them jump. And well, my frogs didn't do very well. I guess I didn't have the technique down. But wow, 3 jumps. They measured the 3 jumps, and at that time that year, the winning frog jumped 13 feet. That's pretty incredible. 13 feet. Anyway, so dynamic frog. What are you going to do is you're going to get back here like that, feet apart a little bit, and you're going to extend yourself over like that. Okay, stretch back and over, and stretch back and over. It's a little bit more active and stretching, but what it's doing here, it's working the inside of the hips here like that. Okay, so there's other ones inside the hips. Oh my God, hip swivels back and forth here like this. Very, very easy. Hey man, I could do that and roll out my hamstrings at the same time. Hey, how about that? Hip, oh man, see, 2 things at once. My goodness. Yeah, saving a lot. Okay. So there's another stretch that's really good. It's a lunge stretch, but a lot of people might have problems with that. So I would suggest starting off sitting on a chair, leg back like that, and put your weight on your front leg, and then extend your back leg out fully, and then get into a lunge. And then you can go up and down like that with a lunge stretch. And that also helps with the hip flexors on the inside. Great. So those are some really awesome stretches that you can do for the hips to get them going. But there's more. What? There's more. Yes, there's more. So what are you going to do if the muscles are really tight? Okay, you've got all these muscles around the hip here. Well, you can use a foam roller. That's really good. I've got another foam roller. Oh my God. So here, what I'd like you to do is you've got anterior, superior, and the posterior part of your hip joint, right? Those are the specific areas that need to be stretched out. So what I'm doing here is I'm holding my weight on it like a trigger point. Very, very easy, very simple. And then I'll move it around to other areas, right? That's very easy. Now, the piriformis muscle. Oh my goodness, the piriformis muscle. What's the test for the piriformis muscle? If it's tight, bring your knee up and your foot out to the side. okay? That's called the fader test, like that. And if you've got a piriformis problem, you're going to notice it here, okay? Knee up, foot out to the side, knee in like that. That's the fader test. If you've got issue with a piriformis, then it'll start to burn there, okay? And try that with the other side, just to see what is going on. Is one side tighter than the other? Huh. Could be, you know, if one leg is a leading leg, then it's an issue, right? So where are you going to get at it? Okay, so you're lying around there and you think, okay, where is it? You work your hip back and forth here like that, and you put your fingers right at the back of the hip joint, and you're just holding on, basically moving your leg back and forth. And you'll be able to feel it, actually. That is where it is. Oh my goodness, right there. Oh, what a relief. Just hold it and then move your knee up and down like that to create a little bit of a stretch. What am I doing here? I'm pinning the muscle and stretching. It's called a pin and stretch technique. All of these things are pin and stretch techniques. Why wear your fingers out? Nope, just pin and stretch, and you'll be able to focus right on the tight fibers that really actually need work, and you'll be able to do that a lot yourself without wearing out your joints or muscles or having them over treated. Oh my goodness. Here's another one, great one here. This one is gluteus medius muscle. It goes all the way up to the hip here, and so you find the muscle border, and then again, bring your knee up, and it's not a lot of pressure, maybe about 2 pounds of pressure. That's all I'm applying. I just want that muscle to feel my finger pressure. That's all. You don't have to dig in there with your elbow. Just let it feel where it is and say, oh yeah, I'm aware of the bullshit that you're causing in my bum. So come on, muscle, you better cooperate. Yeah, just like that. Oh man, great stretch, okay? So this is a great way to treat this area. And then of course there's the quadratus lumborum here. Oh my goodness. How about putting your thumb, long part of the thumb, don't just use the tip, but the long part, the whole hand, okay? You put it right in the square of your middle of the lower back like that, with the thumb pointing down to the hip. And just hold on to that, okay? Move back and forth a little bit. The relief that you'll feel from just doing a little bit of massage like that is going to be intense. It's going to be just so juicy. Probably better than any therapist will ever be able to do on you, because you know why? Because you know where the pain is. Therapist doesn't know, but you do. So why don't you do this yourself? Yeah, you can bend a little bit, stretch. And what am I doing here? Pinning and stretching, pinning and stretching, pinning and stretching. Great. One other technique, it's called a nerve technique, and you're going to use the nail, your nail, okay? And so what you're going to do is you're going to gently, with a little bit of pressure, not a lot, you're going to run from your mid-back all the way down that muscle, across the SI joint, and in through the bum, all the way down to the bottom where the sit bone is. Okay, do that a couple of times, just using your nail. Run back and down like that, and you wouldn't believe, but probably in 10 minutes time, all that back pain will have magically disappeared. Oh my God, did I say the word magically? Woo-hoo. So anyways, that is a nerve technique, okay? Your thumbnail. So if next time you're at a massage therapist and the massage therapist is using his nails, you'll know, he's using another, it's a stylus. Okay, I'm using a stylus, my fingernail, my thumbnail. Okay, so that's a nerve technique, believe it or not. Okay, great. So that's just getting this started. Now we're ready to rock the strength into this, because you can stretch and massage all you want and get it all aligned, but you have to strengthen this stuff too. So what are you going to do? Well, get your ass out onto the track, okay? Perfect. Do some fartleks. Start off with, that's where I'm going tonight, actually, at 11 o'clock, okay? Going out to Balaclava Park to run around the track. Yes, sir, indeed. And it's going to be 200s. Zoomy 200s, I'm going to call them, and there's going to be 12 of them tonight. It's going to be 200s at 70% burn, and then 100 meters at 40% burn. Okay, so do that over and over and over again, and I bet you that you'll be coughing up a lung. Maybe I will, I don't know. But that's how I do zoomies. And then, of course, there's other ones. There's, 400s and 800s and 1500s. Okay, it's all the buildup. And so this is creating strength. And so there's a way of running, too, that is really interesting, too. Because you can be zooming along here like this and, holding your breath. No, don't hold your breath, man. Yeah, you have to breathe with your arms. Okay, so what I'm doing here is breathing out on one side, then breathing in twice, and then breathing out on the other side. So again, breathing in twice, and then breathing out on this side again. And that creates a balance in the body here with breathing. Okay, balance is health. You heard it here first. Okay, so that's tracks. Okay, and then of course there's interval training where you can warm up for 5 minutes or 20 minutes, and then depending on your distances, what you want to do, you can even do cross training in that, or cycling and stuff like that to get your body working. I've seen some crazy things where people have been doing a fast step thing like that just to get your cadence going and get your body used to the actual speed of cadence rather than just slowing. Oh man, why would you want to go faster? Well, I'll tell you why, because in Ohio I ran a race. It was this one called the Shawshank Hustle. Oh my God, this place here in Mansfield on Ohio has a reformatory called the Shawshank Reformatory. I don't know if you know anything about state prisons, but this one is notorious. Anyways, I'm going there, maybe a third of the race through. What comes down in front of me is a train arm. Ding, 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 ding. And it's like, what the heck? So I, just put on the afterburners, and I was only about 100 yards away from the train arm. Anyways, the train arm came down, and probably about 80% of the field was stuck behind a train arm for 5 minutes. And it was magical. I thought I had all the time in the world. Man, dude, I was exhausted. But anyways, I went and finished the race and finished in the top 100, which was a real awesome thing for me to do. But a train arm and a train coming through the actual race course. What's next? So anyways, so what are you going to do to train up these muscles so that you can beat the locomotive? I did, but there was a lot of people that didn't. Okay, so you got a pull cord here. Look at that, it just magically appeared. Okay, so what you're going to do here is you're going to strap your foot in there like that. Okay, lean back a little bit. Okay, and up and down. Up and down. It's raining too much outside. Okay, I'm going up and down then, like this. Okay, doesn't have to be a lot of strength. You can use as much as you want, but that's a great strengthening exercise for the hips. Okay, and then there's a tap test too, which is really, really crazy. You got to get yourself up on a ledge like that and let yourself over like this, and then you're going to take your weight and put it on your foot and then tap back and forth here like that with your foot. Okay, you can do 3 parts: forward, outside, inside, forward, outside, inside, forward, outside, inside. These muscles are going to get really strong really quick. It's something that you can do on a chair even, or on your bed. It doesn't have to be for a long time. Try it for 30 seconds, a minute, just to get yourself going. But these are great little strengthening exercises that you can do yourself, and you'll see a result from it. All right, so I've worked half an hour now, and I'm open to questions. Any questions? I know there's a lot to think about. Holy cow, Tilman, you covered a lot.
And there's a lot of great stretches in there.
Oh, wait a second. I wanted to tell you something about the hamstrings, right? You were going to
Right.
say,
Yes.
I've got a pain right at the top of the hamstring, right at the sit bone,
Yep.
and then
Right
also
there.
part of the gluteal muscle, okay?
Yeah.
So the gluteal muscle, it's not on the inside, but guess what? It could be on the inside, right? It could be a tailbone issue, right?
Yeah.
And so there you can work your fingers back and forth in like that. And if it's sore, then that could be a problem. Okay. You can hook your fingers in on the inside of the bum cheek there. There's a tendon that runs from the tailbone off to the sit bone. Okay. And just hook and hold onto that. And that might give you some relief. And what it will also, sometimes what happens is the tailbone is pulled over to the one side, and that's the issue. So if you were to put a little bit of pressure on that tendon, then sometimes the tailbone will magically try to center itself again. Okay, but that part here, the sit bone, is a problem, but it's not the biggest problem. The biggest problem is the gluteal muscle. Here, it comes out to the side like that on an angle. And a lot of people think, where on the gluteal muscle is it? Is it up here? No, no, no. And people say, no, no, it's down at the bottom where it joins in into the tendon. What is that? Okay, so you're going to hook at that muscle, and you can find it. Okay, hook and hold it. And then again, just a pin and stretch. All what you're doing is you're hooking and holding, and you're moving the knee up and down like that. You'll be able to find the spot better than the therapist will. Okay, and that's going to help you immensely. Okay, because a therapist, they'll probably start working on your shoulder. God, I hate when that happens. Anyway, so that's called client-specific care or client-directed care. Don't be afraid to tell a therapist what you want done specifically, because they got to know. They're not mind readers. They might have a crystal ball, but they're not mind readers, right? So that is client-specific care. There's also age-related or age-specific care. Oh my goodness. I work with a lot of spinal cord injured people, and young spinal cord injured people need different type of care than older spinal cord injured people, only because their body is still developing. So, hey man, get the stim on the legs, keep the muscle masses there. So when the nerves start to grow again and reconnect at the spinal cord, the muscles are there to work. Otherwise, it's game over. Your body's trashed. Okay, so as simple as that, right? Very, very specific. And so it is also not just for spinal cord injured people, but also for other people too. Okay, so age related and client specific related. Okay, and so there's the hamstring. Again, you can bring two fingers together here like that, and then put them right at the sit bone, right below the sit bone, not on the bum side, but on the leg side. And again, pull up on the knee, and you'll probably be able to dig around in there and find specifically where the problem is, and you'll be able to pull and stretch. So it's pin and stretch, pin and stretch like that. Okay, it's going to give you quite a lot of relief. You can go all the way into the center or closer to the midline, and you'll find that there's going to be some muscles that will probably be, well, sharing the problem, and it's probably from doing, I'm going to say, doing some squats. That's usually how people overdo that area. It could be also from doing a lot of sitting and just not doing a lot of moving around. So if you want your rockets to work for you, and you want to go out and beat a train, then you have to work at it. And so stretching is one, self-massage is another, but the focus should be on strengthening, right? What are you going to strengthen? Fronts. Okay, if you strengthen the fronts here, loosen off the muscles at the back, tight bum muscles, if they're really tight, Oh, I've got a problem with this too. You know, I'm running around and it's like tight, it's giving me pain. Yeah. Where's the pain going? It's going into the lower back because the lower back on this side is overcompensating. Because when it's tight here, guess where it's going to work? I want to throw the leg forward. Yeah, okay. Throw the leg forward. It's going to be in the back where you're throwing it forward. So you're running on your legs or you're running on your back? I'm running on my back, right? All right. So there's that. Okay. So once you get these ones all stretched out, and there's some great bum stretches. You can even just bring it up the leg here like this on your back here. Sure, why not, Tilman? And then just pump it. Pump, pump, pump. That's a good glute stretch. You'll notice a little bit of tension. It's not necessary to overdo it. And oh my God, wait a second. There's another great core exercise that's really good too. And that's you're lying on your back here, and all what you're doing is a heel tap on the ground here like that. Just like that. Forget the crunches. Just do heel taps like this. Do the other side. Heel taps. If that's too easy for you, a little bit further apart or further down. If you want to go all the way down, fine, all the way down, and try that too. But that's going to help strengthen up the lower part of your core. Okay? That's very important, and also keep you from getting a lot of back pain. Okay? Belly, no. Back pain, no. Strengthen your core. Okay? Very easy. Wow, so much oh man. There's so much to cover here, but you know, there's one test. It's called a Valsalva test. If you've got issue with your lower back and you think, oh man, you know, I've got a disc injury or something like that, don't sweat it. Try this test. Okay, what you're doing is you're going to breathe in, hold your breath, and squeeze hard. And if you got pain down on one side or like that, then it's going to probably be an issue with the back. But don't stress about it, because let's say if it's a little disc bulge that has come out between the two vertebrae like that, consider it like a bruise. Okay, bruises go away, don't they? So what they'll do is eventually shrink back in like that, and with good strengthening exercises, your back should recover well. Now, last week I also mentioned something about knee replacements, and so you know, there's a lot of people that are back doing their sport after knee replacements, and that goes the same with hip replacements as well. Okay, there was a study that I found where there was 600 people were followed, and only 23 of the 600 people that had full hip replacements went back to running. 23 of them, and it was shown that none of them had any significant problems with running. But I want to put an asterisk there, because a lot of people in our healthcare system, what happens is they wait a long time. And what happens when you wait a long time for hip or knee surgery? You get a lot of compensation, right? And so what that happens, oh my God, then you have to do gait training. Okay, gait training is very important. Core fitness is also very important. What else? Pool running exercises, Pilates, okay? Just to get things going right again. Don't think that you can get yourself a knee or a hip replacement and then you're good to go. No, you're not, okay? And then, of course, the last thing is then to do something very, very simple, but it's called balance exercises, right? And so you try it. You get on one leg and hold yourself up here like this for a little while. And if your foot's going like this and like this, then you've got balance issues, right? And so you get yourself a wobble board, or you go to a gym and on a wobble board, try that. And that's also going to help strengthen not only your ankles, but your knees, but also your hips, okay? All right, questions, what you got?
We have one question here in the comments about using a knee brace or a brace while running. What are your thoughts on that?
Okay, so knee braces are It all depends on what kind of knee brace it is. The first thing that comes to mind is a full brace, you know? So if you've got an osteoarthritic knee or something like that, where it's usually the inside that's worn away and you're then left with the knock knees like this, then you want to have a brace on the inside, right? And so it's supported on the inside. And they can be cumbersome, but people do it, okay? There are amazing garments nowadays with actual airline cables running through them, and they're for hip and knee, basically, and they will give you a lot of lateral support if you have an issue with the knee. Now, if it's just a neoprene cover with a hole cut out of it, then you have to question yourself as to what is it doing? Why are you wearing it? Okay. And so with the knee, don't let the knee brace be your answer. Okay. Get the thing fixed, whatever is going on in there. Okay. Like last week, if it is the meniscus, you can reach in behind the knee. This whole area is fascia. It's all covered by fascia. And so you can reach in with your two fingers like that, get them straightened out like that, put them in behind the knee, and then you'll be able to feel and then stretch out a little bit like that. It works really good like this. Okay. And you can do that on the inside too. Okay. Like that. Okay. But what is it that is causing the knee pain? Is it the biceps femoris here on the outside? Because its tendon runs right at the back of the knee, right? Right there. Bingo. So you put your hands there, you feel around, and if you find that muscle is super, super tight, then chances are then that's the muscle that's causing your knee pain. Okay. It could be a tracking issue with the knee. Okay, if it's a tracking issue, you can push and pull on the kneecap to get it mobile a little bit more. Push on the inside, on the outside to see if it goes. If it goes better here like that when it's on a flat surface because there's no tension on the kneecap. Okay, and then is it jumper's knee or Osgood Schlotter's? I mean, this whole area, lower part is usually what's going on. If it's upper part here, it could be just the quad muscle that's really tight on there. So all these things you have to look out and see what is going on. Or is it osteoarthritis where you have some calcium and mineral demineralization on the inner part of the knee? Or is it time for a knee replacement soon? I guess those are the big issues that have to be discussed as to what it is. Would I run with a knee brace? Yeah, why not? I'm not going to say no. Run with a knee brace. See how it works, but try other things first. See if you can. If you don't feel yourself able to massage it well, get yourself one of these. $80, London drugs, and then work on the inside of the knee, the calf muscle there like that, around the front here, and see if that helps. Okay. Those are the things that you can do. If it's swollen, put a cool pack on there, 10 minutes every hour. Those are the easiest things to do. Is it going to be pretty? No, but you'll be running. Yes. Look at how many hockey players play hockey with knees, right? And so with running, I think the most important thing with any kind of knee replacement or reconstruction is run on surfaces that are smooth to try and avoid any falling or tripping. Or if you're in a race, make sure there's space around you all the time. Okay, if you need to pass somebody, put your hand out in front of them and direct as to where you want to go. Don't just assume that somebody behind you is going to know where you're going. I always put my arm out like that and go this way, or like this and this way, and then I go that way, just to indicate, because it's in their field of view, that somebody's coming up behind them and is going to pass them. So simple. Yeah. All right. Is there any more questions?
There's nothing else in the comments just yet, but anyone else have any questions for Tilman? Going once.
Come on. Tilman, I've got a question for you. Why do you run in costumes? Oh, you run in costumes? Yes, I run in costumes. All my races I run in costumes. Okay. Why? Well, it's just another level of challenge for myself. And it's also something to bring to the race too. Yeah, I'm not out there to, bring attention to me. I'm more out there to challenge other people to run faster.
And you are doing the sun run again this year, correct?
Yeah, in my chicken suit.
How many times have you done the sun run?
Countless times. There's a lot of times that I haven't run because I've been at other races. And so, I don't know, 20 times maybe.
And what's your goal time?
To cross the finish line.
And how long?
Yeah, that's always a thing. I used to go for personal bests all the time. And I worked myself down to 40 minutes for a 10K. The fastest I did it, 40 minutes, a 10K in a costume. All right. I remember one time at the sun run, I was wearing a shark suit that I made at home, and it's like a sleeping bag that I'm wearing upside down, and a little space for my legs to wibble around in at the bottom, right? And I finished that race in 45 minutes. And the commentary from the side, there's like 45 minutes in a shark suit. Wow, that's incredible. So, I mean, I didn't feel stressed, or I was having a great time. And people that I ran by, they were shocked. But maybe that kept me going a little bit, I guess. I don't know. But what's my time nowadays when I run? I just want to finish I want to cross the finish line healthy. I listen to my body, and if my feet start to burn, or if my bum starts to hurt, then I'm going to ratchet it down, because I know that there's always going to be another race. I'm not going to win the race, and I'm going to finish well. I always do, but it's myself that I'm finishing. I'm running my own race, okay? And there's always people that'll come up to me and say, "Oh, what time do you want to beat? What time do you?" I don't, the amount of people who've asked me that, "What time do you want to beat?" I don't know. It all depends on how my body is feeling. If I need to stop and walk through a water station, I'll do it. I don't need to run the whole race. Walk a little bit. Walk. That's how I did my first marathon when I was 9 years old. I finished it. Great. It took me a long time, yeah, but I had a great time.
Exactly. It's perfect. That was what I wanted to hear.
Yeah. Yeah. So do your best. And if you do happen to do a personal best, and if you're motivated by that to do more, then get your ass out on the track and start training after this. Keep going. There's so many races to do. Yeah. Go to Ohio. My goodness. Ohio. Yeah. Mansfield, Ohio. Run as an inmate. Oh my goodness. And try to beat a train. I don't know. But oh my. So, I'm sure that you have lots of crazy experiences in races. I've had a number of them, but that's one that I'm very happy about having done that. That was an awesome race. Okay, so
one more question.
Good.
Yeah. What's your favorite running shoe?
Oh, my favorite running shoe. I don't. I used to run in Brooks. Right now I run in a shoe that's called a 361, and it's a European brand. It's a closed pour sole shoe, And Brooks, their whole line is moved over into a trail shoe. And I went and bought a new pair of Brookies when I was training for the Chicago Marathon in the fall, and horrible. You know, my toe was scraping up against the side of the inside of the shoe, and it's kind of a plasticide or a really hard side of the shoe. It's not soft anymore, and I got a blister, and I thought, dang it. So I started training in my racing shoes, and I thought, okay, I'm just going to wear these 361s and train in them. I don't want to train in them because they're nice and light, and they don't absorb water, because it's something you have to know about shoe beds, right? The sole of the shoe. If it's a closed, poor shoe, it's not going to absorb water. All the other ones, the big foamy things, they're all going to absorb water and get heavier. They don't tell you that, but that's what happens. That, and also the foam starts to collapse a lot more. The thicker the foam, the more it's going to collapse. So there's a whole lot of issues with those thick foam thingies. I'm not happy with them, believe me. And if I had don't get me wrong, Brooks used to have really, really nice shoes. I like the wider ones, so my foot has a lot more space in them, not narrow ones, but everyone has their own way of, their favorite shoes, so I'm not one for one or the other. I'm going to have to get a new pair of shoes probably before the sun run, and so you'll see me shopping around and trying out all sorts of ones. So we'll see what happens next. Maybe it'll be a Saucony or something like that. I don't know. Yeah. So anything else?
I think that's it, unless anyone has anything last minute to ask. No? All right, I'm going to end the recording now.
Okay. It was wonderful. Thanks.